Hello, I'm Jacqueline. Mike asked me to talk a little bit about 99211, often referred to as the nurse code, although it can also be used by medical assistants. I'm going to be referring to some documentation that I've also sent to Mike to pass on to you so that we can see it in written format as well as hear it via audio. This is the second time I'm trying YouTube with a video that CHOC can use in other instances for education to be proactive on coding accurately. So please forgive me if I refer to some written documentation that you have in front of you as we discuss it. And you can pass on any questions to Mike, and I'll also be on the phone conference with you later today. One of the articles I'm sending to you is titled 99211, The Little Code with Big Headaches. We sometimes think that 99211, that California Medicaid only reimburses $12 for, won't be looked at by payers and viewed in any fraudulent way. That's wrong thinking. Just this year long, I've had 2 cases involving providers where I've been asked to assist them in their defense on using 99211 and in what way did they use it and was it documented appropriately. So that's what we're going to discuss today. So it is a little code that pays very little money and has big headaches. So if we are going to use it, let's make sure that we use it appropriately. Towards the end of this session, I'm going to give you some options on some other ways to code that will be reimbursed higher that might work better for you depending on why you're using these codes. The second page of the documentation that I sent to you are some actual scenarios from your own association, Pediatric Association, that gives examples of when 99211 might be appropriate. So for example, a nurse reviews medication lists and uses that list to obtain the peak flow rate for a 10-year-old established patient. The nurse reviews the disease management protocol with the mother and child, including the different problems that they're having. So that one might be, if it's documented accurately, the physician reviews it and signs off on it, that might be an appropriate use of 99211. The next one is a nurse visit, again for a follow-up for growth or blood pressure prior to renewing prescription cycle drugs. So again, this isn't just a routine blood pressure check or temperature check. It's in order to renew different medications that are not standard, not routine, for example, vitamins. So that would be appropriate, again, if it was well documented in the chart note and the provider, the physician or nurse practitioner or PA signs off on it. Again, we need to have medical review and signature. The next example is a nurse evaluation for a follow-up on hearing loss. So a child's come in before and the child's had hearing loss. So the child comes in and the nurse is checking to see on the hearing whether it's getting better, worse. So there's additional codes that we can use as well for the audio checking. That would be another one, again, if the provider reviews it and signs off on it. The next example I use is from, again, your association, the Pediatric Association, that gives some yes and no examples. So the first one is a 7-month-old girl comes in who wants to have the flu vaccination. She was seen only by the nurse or the medical assistant that takes the brief history and learns that this child has a cough but no change in appetite or activity level. Vital signs are taken and the infant has no contradictions to getting the vaccine. So it's discussed per the office protocol. So that brings up, does your office have protocols on how to use 99211? If not, we need to come up with protocols. So per the scenario, the nurse looks at the protocols, goes over the pros and cons of the vaccine for the child, and administers the vaccine. So this would be a yes, this would be appropriate, and so you could bill for the 99211 along with the vaccine and the administration because other items were discussed during this visit. Again, the provider is going to review and sign off on it. Another scenario, and this is a no, a 5-year-old is brought in by the mother for a catch-up on the measles, mumps, rubella, MMR vaccine. Child's fine, there's no contradictions, and it was ordered by the physician prior to this, but for whatever reason that wasn't given. No, you would not give the 99211 or bill that. You would give the vaccine, bill the appropriate administration code for the vaccine, but not the 99211. Here's another example of a 4-month-old has illness with high fever during her preventative visit that was recent, which was 2 weeks ago. The parent comes in and wants to give the second hepatitis B vaccine. The nurse performs the history, finding that the symptoms from the earlier illness has been resolved. Then confirms that the infant's temperature is fine, the observation that the infant's playful, and then discusses the good health of the infant with the parent, documenting this in the medical record, no contradictions to giving the immunization per the CDC guidelines, gives the information to the parent, counseling information, and administers the vaccine. So for this one, again, we could do the 99211 along with the vaccine and the administration code for the vaccine because other items were discussed other than just the vaccine and the administration of it. The next information that I sent along to Mike is called Post-Webinar Q&A on 99211. And these are some good Q&As, not from your association, but from the industry at large, and regarding whether a physician has to be in the office when you do administer 99211. The answer is yes and no, depending on state guidelines. I would say yes in most cases because, for example, it's viewed as incident 2. However, there's some cases when if the patient's coming in and there's a drug screen and they're administering the drug screen and checking for other things to make sure that the drugs are included in the screen. Perhaps the provider is not on site. That's something that we can discuss with Mike and Ken at a later time. So that's in your packet as well to review. And let me just fast forward here on some reasons not to use 99211 would be just routine medications. So somebody's coming in for a refill on routine medication. That would not be where you're just giving them a refill on a medication and you're leaving it with the staff. Checking of blood pressure, again, just general checking, that you would not do as well. Drawing blood, there's a code for drawing blood, so you use the appropriate code. Faxing medical records, nope, can't charge for that either. There's other codes that we can use for record review that we'll discuss in a moment. Recording lab results in the medical record, nope, can't bill that either. However, we can review lab results, the physician, and bill for that, and we'll discuss that code in just a moment. Same with reporting of vaccines. Again, the physician can bill for that review of those records, but it's not staff billing, it's provider billing. So let's move on to what other than 99211 that you can bill for. This is, and I'm sending this along, is from the 2018, and it's not changed from 2019. I'm using this one because you can see it's very colorful. I've used yellow and pink and orange and written all over it. This is a code that you might want to consider and discuss with Mike and implementing with your practice. The code is prolonged service without direct patient contact. The code number is CPT 99358. It is for the physician's time on reviewing records, reviewing immunizations, reviewing labs, making phone calls to the patient, instructing his staff to do certain items like patient education. It's time-based, it's for the first 60 minutes, and it's in conjunction with seeing a patient related to evaluation and management service. So for a preventative well visit or a sick visit, and it can be prior. So perhaps this is a new patient coming in and you've got extensive information to review, and you spend at least an hour and you document that you've spent an hour on reviewing the information, the records from another physician, labs coming in, maybe they were hospitalized, radiology services that you're reviewing, phone calls to the patient, all prior to them coming in or in relation to them after they have left. So they've been a patient, they've come in, you've seen them, then you ordered PT, you've ordered radiology, you ordered labs. Maybe upon a review of labs, you're ordering new medications. All of that is related to a service that you did perform. That, as long as you document, and you document the time because it's for 60 minutes or more, you can bill the prolonged service without patient contact, $993.58. That one does pay for Medi-Cal and probably more for other payers, but California Medicaid pays that at $42 for that code for that 60 minutes. That's something you might want to consider in lieu of the 99211 if that's what you're using the code for. So during our call today, we'll discuss what you're using 99211 for and the appropriate way to bill for it, or perhaps to look at this other code, and we'll discuss that today. Again, I'm Jacqueline Bloink, and I'm the educator, provider educator for CHOC, and hopefully this assists you. Thank you.